Liver diseases in the geriatric population, prevalence, pathophysiology, and diagnosis. Introduction. Aging is a major risk factor for most chronic diseases. The aging-related changes that significantly affect the cellular response to injury are increased oxidative stress, increased inflammatory response, accelerated cellular senescence, progressive organ dysfunction. In addition, other significant risk factors for the liver include hypertension, obesity, diabetes, and hyperlipidemia. Overall, the prevalence of non-alcoholic fatty liver disease (NAFLD) in India is over 35%. Pathophysiology. The liver has a remarkable ability to regenerate and maintain function during the aging process. There are, however, changes on a cellular and physiological level that reduce the overall function of the liver, such as compensatory cell hypertrophy in response to the decreased number of hepatocytes seen with aging. The size of the liver reduces by 25% between the age of 20 and 70, with a 33% reduction of hepatic blood flow in those over 65 years old. The activity in hepatic cytochrome P450 oxidation is reduced along with the reduction in the protective enzyme superoxide dismutase, both of which may contribute to an increased sensitivity of hepatocytes to xenobiotics. A reduction in protective enzymes, a decline in response to growth factors, and a theoretical risk of increased pathogen load from the gut all put the aged liver at increased risk of disease. In NAFLD, at the microscopic level, the size of the hepatocyte nuclei increases due to the shortening of the telomere and polyploidy, resulting in P21 upregulation. Several studies have also shown that in elderly NAFLD patients, the accumulation of excessive fat in the liver results in decreased autophagy, increased M1 macrophages, an increase in inflammatory factors, and activation of the nuclear factor kappa B pathway. Physiologically, the neutral fat and cholesterol volumes in the liver gradually expand as one gets older, and the blood cholesterol, high-density lipoprotein cholesterol, and neutral fat levels also increase over time. Meanwhile, the metabolism of the low-density lipoprotein cholesterol decreases by 35%. In alcoholic liver disease (ALD), microscopically, the alcohol metabolic enzyme in the elderly is reduced over time. Hence, the blood ethanol concentration increases, thereby resulting in the reduction of water in the body. This results in the upregulation of tumor necrosis factor (TNF) and Kupffer cells that accelerate the progression of fatty liver to steatohepatitis. Viral infection. Chronic hepatitis C is another common cause of chronic liver disease (CLD), and it is also associated with insulin resistance, which impairs glucose tolerance. Several mechanisms have been proposed, including fat deposition in hepatocytes, increased insulin resistance as a result of increased tumor necrosis factor (TNF), direct or autoimmune damage to the cells by the virus. Diagnosis. The typical symptoms associated with liver disease in the elderly are similar to the younger patients who are affected with jaundice, malaise, fatigue, anorexia, hepatomegaly, sarcopenia, and fever. But at times, non-hepatic symptoms can also aid in the diagnosis, such as numbness, peripheral neuropathy, dyspnea or fatigue, cardiomyopathy, weight loss and diarrhea, pancreatic insufficiency, and psychiatric or neurologic dysfunction. In addition, the laboratory and imaging tests are the crucials for confirming the condition and consequent treatment regimen plan. In the laboratory test, the biochemical markers such as serum bilirubin, alanine aminotransferase (ALT), aspartate aminotransferase (AST), the ratio of aminotransferases, alkaline phosphatase, gamma-glutamyl transferase, 5' nucleotidases, ceruloplasmin, and alpha-fetoprotein are tested. Most of these biomarker enzymes are found to be elevated in the blood serum during liver disease and injury. However, their levels can be ever-changing or stagnant, such as the levels of AST or ALT were seen to be normal in many elderly hepatitis patients. Therefore, imaging techniques such as ultrasonography and MRI scan are used.